Reversing insulin resistance naturally. Diet, exercise, and lifestyle changes. Welcome to this informative video on insulin resistance, a prevalent health condition impacting approximately 25 to 30% of the global population. As a significant concern in today's society, it is crucial to understand insulin resistance, its underlying causes, and the potential risks associated with it. In this video, we'll embark on a comprehensive journey, exploring the intricacies of insulin resistance, its potential dangers, the symptoms to look out for, and the various natural approaches to effectively manage and even cure this condition. So, let's dive in and unravel the mysteries of insulin resistance. Insulin resistance is a complex metabolic disorder that develops when the body's cells become less responsive to the hormone insulin. Insulin, produced by the pancreas, plays a crucial role in regulating blood sugar levels by facilitating the uptake of glucose from the bloodstream into the cells, where it is used for energy or stored as glycogen for later use. The development of insulin resistance involves several interconnected factors and mechanisms. One contributing factor is the dysfunction of insulin receptors on the cell surface. Another factor is the presence of elevated levels of free fatty acids in the bloodstream, which can result from a high-fat diet, obesity, or other metabolic imbalances. Inflammation also plays a role in the development of insulin resistance. Chronic low-grade inflammation, which can be caused by obesity, poor diet, or other lifestyle factors, can lead to the release of pro-inflammatory molecules called cytokines. As cells become more resistant to insulin, the pancreas compensates by producing more insulin to maintain normal blood sugar levels. However, over time, this increased demand for insulin can strain the pancreas, leading to a decline in insulin production. As a result, blood sugar levels can become chronically elevated, eventually progressing to type 2 diabetes, a serious condition with long-term consequences for one's health. Insulin resistance, therefore, serves as a dangerous precursor to more severe health issues, highlighting the importance of early detection and intervention. There are several risk factors that contribute to the development of insulin resistance. Some of the primary ones include obesity. Excess body fat, particularly around the abdominal area, is strongly associated with insulin resistance. The accumulation of fat tissue can cause inflammation and the release of certain hormones that impair the action of insulin in the body. Physical inactivity. A sedentary lifestyle can lead to insulin resistance as regular physical activity helps increase insulin sensitivity, allowing cells to use glucose more effectively. Poor diet. Consuming a diet high in processed foods, refined carbohydrates, and added sugars can contribute to insulin resistance. These foods can cause rapid spikes in blood sugar levels, putting a strain on the body's ability to produce and utilize insulin effectively. Age. As people get older, their risk of developing insulin resistance increases, partly due to age-related muscle loss and reduced physical activity. Family history. A family history of type 2 diabetes or insulin resistance can increase an individual's risk, as genetic factors may play a role in the development of the condition. Ethnicity. Certain ethnic groups, including African Americans, Hispanics, Native Americans, and Asian Americans, have a higher risk of developing insulin resistance and type 2 diabetes. Hormonal imbalances. Conditions that cause hormonal imbalances, such as polycystic ovary syndrome, PCOS, and Cushing's syndrome, can increase the risk of insulin resistance. Sleep disorders. Sleep apnea and other sleep disorders that disrupt normal sleep patterns can contribute to insulin resistance, as poor sleep quality is linked to hormonal imbalances and impaired glucose metabolism. Stress. Chronic stress can lead to elevated cortisol levels, which can negatively impact insulin sensitivity and contribute to insulin resistance. Smoking. Cigarette smoking can cause inflammation and affect insulin sensitivity, increasing the risk of insulin resistance. Understanding the risk factors associated with insulin resistance is crucial in identifying potential lifestyle changes that can help prevent or manage this condition. By addressing these factors, individuals can take a proactive approach in improving their insulin sensitivity and overall health. Some individuals with insulin resistance might not experience any noticeable symptoms until the condition has progressed to prediabetes or type 2 diabetes. However, being aware of the potential signs can help individuals identify the issue early and seek appropriate medical intervention. Here are some common symptoms associated with insulin resistance. Fatigue. People with insulin resistance might experience persistent tiredness or fatigue, as their cells struggle to absorb glucose efficiently, resulting in reduced energy production. Weight gain. Insulin resistance can lead to weight gain, especially around the abdomen. The excess insulin in the bloodstream can promote fat storage, making it difficult to lose weight. Frequent hunger. Despite consuming adequate calories, individuals with insulin resistance may feel hungry more often, as their cells are not effectively utilizing glucose for energy. Difficulty concentrating. Fluctuating blood sugar levels can cause brain fog or difficulty concentrating, as the brain relies on a steady supply of glucose for optimal function. Skin changes. Insulin resistance can cause dark, velvety patches of skin called acanthosis nigricans, often found in skin folds or creases, such as the neck, armpits, or groin. High blood pressure. Insulin resistance is often associated with high blood pressure, as it can cause the blood vessels to become less elastic and impede blood flow. High cholesterol levels. People with insulin resistance may have elevated levels of triglycerides and low-density lipoprotein, LDL, cholesterol, along with decreased levels of high-density lipoprotein, HDL, cholesterol, increasing the risk of cardiovascular disease. Polycystic ovary syndrome, PCOS. Women with insulin resistance may develop PCOS, which can cause irregular menstrual cycles, excessive hair growth, and difficulty getting pregnant. Sleep problems. Insulin resistance can contribute to sleep disturbances, such as difficulty falling asleep, staying asleep, or feeling refreshed upon waking. If you suspect that you may have insulin resistance or are experiencing any of these symptoms, it is essential to consult with a healthcare professional for further evaluation and guidance. Diagnosing insulin resistance can be challenging, as the symptoms may be subtle or absent in the early stages. However, healthcare providers use various blood tests and take into account an individual's medical history, symptoms, and risk factors to determine if insulin resistance is present. Here are some common tests used to diagnose insulin resistance. Fasting blood sugar. This test measures blood sugar levels after an individual has fasted for at least 8 hours. Elevated fasting blood sugar levels can indicate impaired glucose metabolism, suggesting the presence of insulin resistance. Criteria for diagnosis: normal, 70 to 99 mg per deciliter, 3.9 to 5.5 millimole per liter. Pre-diabetes, 100 to 125 mg per deciliter, 5.6 to 6.9 millimole per liter. Diabetes, 126 mg per deciliter, 7.0 millimole per liter, or higher on 2 separate tests. Glucose tolerance test, 2-hour oral glucose tolerance test, also known as the oral glucose tolerance test, OGTT. This test involves measuring blood sugar levels before and at regular intervals after consuming a glucose-containing drink. This test helps determine how effectively the body processes glucose, with abnormally high blood sugar levels after ingestion indicating insulin resistance. Criteria for diagnosis: normal, less than 140 mg per deciliter, 7.8 millimole per liter. Pre-diabetes, 140 to 199 mg per deciliter, 7.8 to 11.0 millimole per liter. Diabetes, 200 mg per deciliter, 11.1 millimole per liter, or higher. HbA1c. The hemoglobin A1c test measures the average blood sugar levels over the past 2 to 3 months by assessing the percentage of glucose attached to hemoglobin in red blood cells. Higher HbA1c levels can indicate poor glucose control and suggest insulin resistance. Criteria for diagnosis: normal, less than 5.7%. Pre-diabetes, 5.7 to 6.4%. Diabetes, 6.5% or higher on 2 separate tests. Insulin level test. This test measures the amount of insulin in the blood. Elevated insulin levels may indicate that the body is producing more insulin to compensate for reduced insulin sensitivity, a sign of insulin resistance. Normal varies depending on the laboratory, but typically ranges between 2 to 25 micro-IU per milliliter. Abnormal values outside of the typical range may indicate insulin resistance, but it's essential to consider other factors such as glucose levels, HOMA-IR, and clinical symptoms. Homeostatic Model Assessment of Insulin Resistance, HOMA-IR. This test uses fasting blood sugar and fasting insulin levels to calculate an index of insulin resistance. A higher HOMA-IR value suggests reduced insulin sensitivity and the presence of insulin resistance. Normal varies depending on factors such as age, sex, and ethnicity, but a HOMA-IR value of 1.0 to 1.4 is generally considered normal for a healthy, non-diabetic adult. Abnormal HOMA-IR values above 1.9 to 2.9 are often indicative of insulin resistance, with higher values suggesting more severe resistance. Please note that the above ranges are for general informational purposes only and should not be used to diagnose or treat any medical condition. If you suspect you may have insulin resistance or another health issue, consult with a healthcare professional for appropriate evaluation and guidance. In managing insulin resistance, both pharmacological and non-pharmacological treatments can play significant roles. Here, we will discuss these two approaches separately to help you understand the various options available for managing this condition. Pharmacological treatments. Metformin. Metformin is the most commonly prescribed medication for insulin resistance and type 2 diabetes. It works by decreasing the amount of glucose produced by the liver and improving insulin sensitivity in muscle cells. Metformin can help lower blood sugar levels and reduce the risk of complications associated with diabetes. Thiazolidinediones, TZDs, such as pioglitazone and rosiglitazone, are medications that help improve insulin sensitivity by activating the peroxisome proliferator activated receptor gamma, PPAR gamma. This receptor plays a crucial role in regulating glucose and lipid metabolism. TZDs can be prescribed to individuals with insulin resistance or type 2 diabetes to help lower blood sugar levels. DPP-4 inhibitors, sitagliptin and linagliptin, work by increasing the levels of incretin hormones in the body. These hormones help stimulate insulin release and decrease glucagon production, resulting in lower blood sugar levels. Berberine. Berberine is a natural compound found in various plants and has been used in traditional medicine for centuries. It has been shown to improve insulin sensitivity and lower blood sugar levels, making it a potential alternative to pharmaceutical medications for some individuals. However, it's essential to consult with a healthcare professional before taking berberine, as it may interact with other medications or have side effects. Non-pharmacological treatments. Healthy diet. Adopting a healthy diet is crucial for managing insulin resistance. Emphasize whole foods, lean proteins, and fiber-rich foods, including whole grains, fruits and vegetables, lean proteins, healthy fats, and fiber-rich foods. Minimize the consumption of processed foods, refined sugars, and unhealthy fats to help lower insulin resistance and improve overall health. Regular exercise. Engaging in regular physical activity can help improve insulin sensitivity and lower blood sugar levels. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, such as brisk walking, swimming, or cycling, along with resistance training exercises, like weightlifting or body weight exercises, twice a week. Weight management. If you are overweight or obese, losing weight can significantly improve insulin sensitivity. Even a modest weight loss of 5 to 10% of your body weight can have a positive impact on blood sugar levels and insulin resistance. Stress management. Chronic stress can contribute to insulin resistance by increasing the release of stress hormones, like cortisol, which can impair insulin sensitivity. Incorporating stress reduction techniques, such as mindfulness meditation, deep breathing exercises, or yoga, can help manage stress levels and potentially improve insulin resistance. Sleep. Getting sufficient sleep is essential for overall health and can help regulate blood sugar levels. Aim for 7 to 9 hours of quality sleep per night, and address any sleep issues, such as sleep apnea, with the help of a healthcare professional. By combining pharmacological treatments with non-pharmacological approaches, you can effectively manage insulin resistance and prevent its progression to more severe health issues, like type 2 diabetes. Other natural remedies can also aid in managing insulin resistance and improving overall health. 2 such options include insulin plant. The insulin plant, Costus igneus, is a medicinal herb known for its blood sugar-lowering properties. The leaves of the insulin plant contain phytochemicals that may have a positive effect on blood sugar levels, making it a potential natural remedy for people with insulin resistance. Adiponectin. Adiponectin is a protein hormone produced by fat cells, adipocytes, that plays a vital role in regulating glucose levels and fatty acid breakdown. Higher adiponectin levels are associated with improved insulin sensitivity and lower risk of developing type 2 diabetes. To monitor and potentially increase adiponectin levels, speak with your healthcare provider about testing your adiponectin levels. This can be done through a blood test, which can help determine if your levels are within a healthy range. To increase adiponectin levels naturally, consider adopting lifestyle changes that have been shown to promote higher adiponectin levels, such as losing weight, engaging in regular physical activity, and consuming a diet rich in monounsaturated fats, found in foods like olive oil, avocados, and nuts. As we wrap up this informative video on insulin resistance, remember that the power to improve your health is in your hands. By understanding insulin resistance and taking proactive steps to lower it naturally through diet, exercise, and lifestyle changes, you can significantly improve your health and potentially prevent the progression to more severe health issues like type 2 diabetes. Stay motivated and consistent in your efforts to reverse insulin resistance, and you'll be on your way to a happier, healthier life. Don't let insulin resistance hold you back from living your best life.